This is a demonstration for practical 2, practical 1 CNS. So in this practical, you will be looking into gross images only. The first image is on the clinical signs of hydrocephalus. Four main features of hydrocephalus. Number one is you can see the head circumference is enlarged. Basically, the circumference is increased, and you can see there is actually bulging of the fontanelles, and you can also see the dilated, prominent dilated veins on the head, as well as the peculiar signs in the eye is called sunset eye. Okay. Next is on cerebral edema. So in normal surface of the brain, you can see the groove called sulci and the prominent area of the surface of the brain called gyri. And what happened in cerebral edema, this gyri becomes widened, and this causes the groove or the sulci to become compressed. Okay. This is the features of tonsillar herniation. So you can actually see this is a cerebellum, and you can see there is actually a protrusion of the brain stem tissue, as well as indentation of the brain stem tissue that follows the mold of the foramen of magnum. And this is actually a feature of increased intracranial pressure. Another features of increased intracranial pressure, another type of herniation is called subfalcine herniation. So this is actually supposed to be the falx cerebri line, and you can actually see some of the brain tissue protrude through the lower part of the falx cerebri, and this is what we call as subfalcine herniation. So there's actually midline deviation, and you can also see there's actually a the ventricles here is the right ventricle is there, but the left ventricle is basically compressed. Next one is on hydrocephalus. So this is to show that this is actually a brain, and you can see the ventricles are basically enlarged. So bilateral, the enlargement is basically bilateral. This is actually a features of Berry aneurysm. This is actually the circle of Willis, and you can actually see aneurysm protruding from the blood vessels, and this aneurysm are basically ruptured. Okay, and the type of aneurysm is called circular aneurysm. We are going to look into different types of hemorrhages. The first one is intraparenchymal hemorrhage. As the name, it is basically hemorrhage inside the parenchyma of the brain. Majority of time this is caused by either motor vehicle accident or even hypertensive vascular stroke, and it causes rupture of the blood vessel inside there. And this is actually a feature of in subarachnoid hemorrhage. So you can actually see majority of the time this is due to the rupture of the Berry aneurysm that I showed you before, and the location of aneurysm of the circle of Willis is actually in the subarachnoid space, and this is actually due to the rupture, and this is the collection of the blood there. So you can actually see you can actually label the areas of hemorrhage there. The next one is the subdural hemorrhage. So basically, by the name, this is the dura, and it actually occurs below the dura, right? So this is actually subdural hemorrhage. And epidural hemorrhage is basically bleeding that occurs above the dura. So this is the dura, and this is the hemorrhage. And you can actually see this is actually the meningeal artery, and usually this is actually the cause of the bleeding, usually due to motor vehicle accident, and it actually causes the hemorrhage to collect at the epidural area. Thank you.